EuroPD conference this year continues to be underpinned by new knowledge gained from excellent research, as well as from the experience of doctors working with patients. We'll be sharing this knowledge at the conference and looking at how our basic research may inform future treatments for patients.
In Poland, these days we have around 1,000 patients a year on PD. In the country of 38 or 40 million people, which is not a lot when you look at the percentage of patients who are on PD in comparison to hemo. There's only 6%. It used to be higher than that. It used to be around 10%. We have a lot of obstacles and problems, the same I would say as they are everywhere in the world. And we still need to work a lot into increasing the penetration rate, but mainly into increasing the possibility that the patient can choose PD, because in many instances they just cannot choose it because they are not offered it properly. Another thing is awareness from the doctors that they feel there are a lot of barriers, and these myths about peritoneal dialysis are taken into consideration, that not really a lot of patients with end-stage renal disease can be peritoneally dialyzed. We are helping in two things: increasing patients' awareness and increasing doctors' awareness. So nephrologists and doctors should know what are the benefits for our patients if they are on PD. We try to introduce the pre-dialysis training to almost everybody, so that the patients know what is peritoneal dialysis, that they have this method, and to show them when you have the treatment that you are involved yourself. Doesn't have to be necessarily a bad treatment or a treatment that you would not be able to take. I'm very happy that EuroPD has come to Poland, that Poland has been chosen for this meeting. And I find that this is a good platform for people to discuss the clinical problems, but on the other hand, scientific problems that are important. We still need more and more research to prove that it works, to find new ways to improve outcomes. This is a great opportunity for us to have EuroPD here. I'm very happy about that.
My research group is really interested in understanding the control of inflammation, and we try to understand the mechanisms which determine the appropriate control of inflammation, providing defense against infection, for example, but then also trying to think about what triggers the transition to a more kind of chronic inflammatory condition, whereby fibrosis, for example, within the peritoneal cavity as a consequence of repeated infection or continued peritoneal dialysis is actually driving that process. So we're really interested in the cytokine networks that are set up and trying to understand the relationship between the inflammatory cells that are brought into action as a consequence of, say, infection, but how they interact then with the stromal compartment, with the mesothelium and the underlying compartment, trying to understand a little bit more about checkpoints that may be regulating that transition to more chronic disease.
The work of the person that's missing here, I think, is Phil Taylor with his work on macrophages in Cardiff, and the interaction there between the tissue-resident cells, which maybe have that important homeostatic function, and then in response to inflammatory stimuli, the other types of macrophages coming into the cavity and maybe driving disease as well as resolution of infection.
Absolutely, yeah. I think the monitoring of the environment is extremely important. And the resident macrophages there are actually the frontline sentinels, really sensing what's going on at a very early stage.
And then there's work, as you know, back in Cardiff in the lab, looking at the role of microRNAs, these post-transcriptional regulators, in driving the phenotype of different macrophage populations in the cavity, and we're just getting some exciting results there, identifying different patterns of those small regulators which appear to control different types of cell within the cavity, and I guess we'll see where that goes in terms of manipulating them for potential therapy in the future, but certainly at least finding out about what controls the phenotype there.
Absolutely, yeah. If we can get an angle on that, then we really have opportunities to identify new opportunities for biomarkers, trying to think about early ideas about what's causing these particular conditions to arise. And perhaps we can then use that to kind of select therapies and opportunities for targeting better in this particular context.
So our research basically approaches the field of PD from two sides. One is finding new additives for PD fluids to improve these fluids eventually. And the other approach is to find biomarkers, because you actually have to be able to evaluate the improvement of these fluids in an efficient way, and to find markers of increased survival of peritoneal cell populations, of peritoneal membrane function, and so on. And we try to do that with omics techniques, for example, where we try to link molecular phenotypes to the patient phenotypes and identify potential biomarkers. So EuroPD has been an amazing experience so far, and we hope that it continues to be, because it's a concentration of the most productive and innovative people in this field in Europe, and there are also a lot of outside collaborations, so the network in and around EuroPD spans really the continent, and there's been so much input to our research and so much collaboration. It has been really a fascinating journey, and we hope that it continues in a productive way. So in Vienna, there are two early stage researchers working in EuroPD. There's a strong collaboration between Cytoprotec and the Medical University. Katarzyna Bialas has been investigating a new potential cytoprotective compound for peritoneal dialysis fluids, and she has been involved in the development of this potentially new product to being an additive that is applied in humans at some point. And on the other side, Silvia Tarantino from the Medical University has been collaborating with Cytoprotec and also using omics methods and proteomics techniques to evaluate the effects of these additives in peritoneal dialysis fluids.
Can you tell me about the EuroPD program?
EuroPD is a European network in peritoneal dialysis founded for the last year from European Commission, and aims to train and educate young researchers that fill the gap between early researchers and experienced researchers. It focuses mainly on the identifications of biomarkers and translation of these biomarkers into clinical research field.
Can you tell me what the highlights of the EuroPD program have been for you?
So the highlights of EuroPD are the biomarkers that we are trying to find to diagnose this PD patient at day one, the infection in this PD patient, and especially in Cardiff we are studying the role of conventional T cells, how these cells they can allow to detect the infection at day one in this particular patient. And so I think that in these 3 years we aim to identify the critical point that will allow us to identify good therapy for this patient. So this has been great for us.
And the training. We have received broad training on every aspect of PD, and this made us good ESRs that we will try to meet the old professors and in the field and try to fill the gap to help patients.
EuroPD gave us the unique opportunity to work within an international environment, and we had the opportunity also to exchange, to work in a different lab within Europe, and those collaborations resulted in the end in really nice and impact factor publications that we hope will really improve the peritoneal dialysis field.
So, in addition to the training, we also had the opportunity to participate in different conferences, which resulted in poster presentation and also presentation itself during the conferences, which gave us the chance to show our results and also open new collaborations for the future.
The EuroPD register is a comprehensive European registry of patients on renal replacement therapy, so dialysis and transplantation, and it includes more than 500,000 patient records, so it's very well able to provide a comprehensive picture of RRT in Europe. The registry is important for patients with renal failure because it gives them an idea on the outcomes of renal replacement therapy. For example, because our registry is so large, we are able to show that the outcomes between hemodialysis and peritoneal dialysis are very similar. On the other hand, the good news is that both patient survival on hemodialysis and PD are improving over time. I think that's a very relevant message for patients.